Hi everyone, I'm Dr. Laura from Yellow Brick Physical Therapy in Boulder, Colorado. And this video gives you a little more information on how to use a TheraCane to help with the front side of your spine. In my last video about the low back, I mentioned how your spine has a back side and a front side. Most of our pain tends to be on the back because of if we're pulled forward, it creates a counter force on the back, but lots of times the front stabilizers have a big impact on why we feel pain on the back. So this is based upon how I help a lot of people clinically who have back problems. And so you want to lay down and on a floor or a bed is fine too. And the nice thing about the TheraCane, this is a move I would say I made up myself. I'm not sure if everyone uses it this way, but because of the leverage, say you come just to the right of your belly button, you're going to be able to just relax, place your hand on top, and let your arms relax. And it's not quite the same as having someone do it for you because there's some amount of tensing up when we're trying to self-treat, but if you can relax as much as possible, you can release some of these areas along the spine. And so what I recommend you do is go down along an imaginary your midline, or maybe an imaginary zipper line along your front, all the way down, spending about 3 minutes at each point to just above your pubic bone. And now you can also come out to the side along your iliacus. So if you follow the bone on the outside, you might find points of tenderness. And again, you want to just hold, not move around a lot. Coming back to your navel, you can work your way up towards the rib cage, because the psoas muscle, this front stabilizer muscle, attaches all the way along the front side of your spine at each vertebrae and its disc, from T12 or just below your rib cage on the front side, all the way down to attach to your leg. When it gets short and tight, it can create a lot of spine compression and back problems. So you can work your way all along the right side and then all the way along the left side. You might go left of your belly button and then down to just above your pubic bone. You can come out to the side into the iliacus or just inside your hip bone. And again, spend time there. And then from your belly button on the left side, you can work your way up to the bottom of the rib, just under the bottom of your rib cage. And that's a really good way to help back problems. Now there's more to that equation, so if you have any questions, please comment, reach out, call me, and I'm happy to support you and help you understand what else can be done to resolve back issues or things like that. Or especially if you feel a lot of tenderness in here, it could be a really great way for you to know and discover something you might not have realized that's contributing to any back or hip problems that are going on. The other thing I want to point out is there's a neurological aspect to how muscles work. So nerves control muscles. So here we're really working on the muscle part, but there's a nerve component that if this isn't helping entirely, maybe it's helping short term, that makes sense, because when you just work at the muscle or the joint level, you get some short-term results, but we want long-term sustained results. And in that way, I always treat the nerve first. So let me know if you have any questions and enjoy. I hope that helps. I'm Dr. Laura Johnson from Yellow Brick Physical Therapy.